Welcome back to News Channel 7 at noon. It is February already. This month is Heart Health Month, and next week is Cardiac Rehabilitation Week, something very important for us to know more about. Joining us today, we have Elaine Greig with Bay Medical Sacred Heart to tell us more about some cardiac rehab services that are available here locally. Elaine, thank you so much for coming out here today.
Thank you, Donna.
And this is really important because there are many services that are available that could really be benefiting a lot of people's cardiac health. Can you tell me a little bit about that?
Absolutely. Cardiac rehab is designed to help people who have had heart attacks, open heart surgery, angioplasty stents, and now they've just added congestive heart failure. And it's to get them through after their surgery and things like that. Then we do education, exercise, teaching, dietary changes so that they get the information so they can do a lifestyle change for themselves. So we empower them with the knowledge, the information, give them the tools so that they can carry on their life and hopefully prevent a secondary situation from occurring.
Okay, so this is really something that's important after somebody's had a heart incident to make sure that they don't have another one. So what sort of things are involved with cardiac rehab?
Well, the first thing we do is when we get a referral, we'll go ahead and check the insurance and everything to make sure that, if they have any payment or if their insurance covers it. Then we get the patient in and we do a complete assessment. And based on the assessment and the patient's needs, then we'll do an exercise regimen that's appropriate for them. There's usually 8 people to a class at a time, but everybody's doing their own thing. Each person in the class is on a heart monitor, and we're constantly monitoring their heart rate and rhythm. We're getting their blood pressure, and we're also getting feedback on how they're feeling. Wow. At the same time, we're also doing a whole bunch of education, anywhere from, looking at their diet, looking at their medications, looking at even, the sodium intake, a lot of different areas. Psychosocial, is also a very important part of it. Laughter and happiness is very important to healing.
Reducing stress.
Yeah, exactly.
And really, February is the month where we start really focusing in on the importance of heart activities, but this is something that we should be thinking about 365 days out of the entire year. We have to take care of our heart above and beyond everything else.
That's absolutely true. Another thing is when our patients come in, if they've already had a heart attack or an episode, they're at risk. Well, so aren't their loved ones. So we tell them to take this information and share it with their spouse, with their children, so maybe they can prevent themselves from having something.
So many people think, well, I'm already in a bad situation, but it's never too late to start really reversing the odds and taking care of yourself and giving yourself the best chance of not having a repeat incident when it involves the heart.
Absolutely. A lot of risk factors that can avoid from happening.
Certainly. All right, Elaine Greig, some really great information. Of course, Bay Medical Sacred Heart, there to take care of your heart in so many different levels and are there to answer some questions. And if you're interested in these classes, it's good to give them a call.
You can give us a call. You can check with your physician.
See if you're right for it.
And we'll be happy to answer any questions and find out the information for them to get them in and if they qualify. Absolutely.
Right. Terrific. Thank you very much. Some great services and cardiac rehab right here in our area. You're watching News Channel 7 at noon. We'll be back with more in a moment.